Hi, welcome to the Healthy Brain Fair. Alzheimer's Family Center is very happy to introduce to you today Dr. Cheryl Alvarez. She is the Director of Outpatient Behavioral Health at Alzheimer's Family Center. She is a clinical psychologist specializing in neurodegenerative diseases such as Alzheimer's disease and other related dementias. Dr. Alvarez completed clinical rotations at Fairview Hospital, U.S. Keck Institute of Prevention Research, and the Brain Injury Center. Dr. Alvarez works to develop new programs to serve the aging population and serves as a media expert and speaker on brain health and Alzheimer's treatment. Please help me welcome Dr. Cheryl Alvarez.
Good morning. Welcome to the Healthy Brain Fair brought to you by Alzheimer's Family Center. I'm Dr. Cheryl Alvarez. I'll be talking about healthy brain aging and how it's not all in your head. Alzheimer's Family Center is an adult day healthcare located in Huntington Beach with the mission of creating happier and healthier days. We work to improve the quality of life for families challenged by Alzheimer's disease or other dementias through services tailored to meet individual needs for both patients and for caregivers. So today I want to talk a little bit about why healthy brain aging is a priority. And we'll sort of talk about the overall prevalence of Alzheimer's disease. You've probably heard a lot about it. We see a lot of news about Alzheimer's disease. You very likely know someone, have someone in your family or in your life who's been affected by Alzheimer's disease. Currently, there are about 5.8 million Americans with Alzheimer's and about 84,000 residents in Orange County. This number is expected to double by 2030, so this would definitely be considered a global health crisis. So today we can kind of talk about ways that you can improve your brain health, ways that you can decrease your risk, maybe a way that you can help a family member with dementia, and ways that you can support a caregiver. There are some things with Alzheimer's disease that are in our control and some things that are outside of our control. So outside of our control include things like age and genetics. Age is the biggest risk factor for Alzheimer's disease. There is an increase in risk at age 65, and then also an increase in risk at age 85. So that's really the number one health risk is your age. Genetics, of course, can play a role as well. The genetic risk can be determined by a number of different factors. One of them is if there is a family history of Alzheimer's disease. Another is a history of other medical conditions such as diabetes, hypertension, or hyperlipidemia. So obviously we can't control those things, but the good news is that even if your genetic predisposition is there are still things that you can do to reduce your risk despite that. Issues related to obesity in midlife or even malnutrition can increase your risk for dementia. So keeping physical health, fitness, and good nutrition in place will help minimize that risk. Cardiovascular disease is also a risk. People sometimes forget that your heart is connected to your brain. So the things that affect your heart will also potentially have a negative effect on the brain. Particularly high blood pressure, high cholesterol, both of those things can increase your risk of stroke and or heart attack and lead to the potential for dementias to set in. Diabetes is another illness that has been connected to different types of dementia. So managing the diabetes, keeping the numbers in check, or even resolving the diabetes will all be ways that you can improve your brain aging as well. Even people who have diabetes but keep it under control can reduce their risk just by managing it. Smoking. So it won't probably be any surprise to anyone that smoking has a negative impact on your health. And this is also true, whereas it can be related to increases in your risk for developing neurological illnesses or memory disorders later in life. And lastly, but certainly not least, depression. This is kind of a subtler symptom, but the research does show us that people who suffer from depression earlier in life do have a higher risk of dementia or other neurological illnesses later in life. So I will talk more about how to manage that in order to keep your brain healthy and reduce your risk. When we're talking about issues of health management, so these are all priorities, and if we were to prioritize them, certainly stopping smoking would be a top priority. Managing your blood pressure and cholesterol would be up there in top priorities, and also treating any active depression would all be priorities. And so these are things that you can work with your primary care physician or your other healthcare providers or team to really give your brain a boost to keep it strong and healthy. We're going to talk a little bit about nutrition, since obviously everything we put into our body that can have an effect may ultimately impact your brain health. So this is a wonderful quote, let food be thy medicine and medicine be thy food. I want to give you some examples here. So you may have heard of the MIND diet. So this is a study that came out several years ago. And the study is very interesting because they took about 1,000 people who participated in the study for around 8 to 10 weeks or so. And the average person in the study was about 81.4 years old. So we've got almost 1,000 81-year-olds participating. And the study said, let's eat more of these. So green leafy vegetables, berries, unsalted nuts, olive oil, whole grains, fish and poultry, not fried fish and poultry, but steamed or cooked otherwise, beans, and even a little bit of wine. All of those things, eat more of these, 8 to 10 weeks. And the diet, the MIND diet in the study said, eat less of these things. So less butter, margarine, less cheese, less red meat, and then of course the processed foods, fried foods, pastries, and sweets. So to recap, more of these, green leafy vegetables, berries, nuts, olive oils, kind of a Mediterranean diet flair, and less of these things, and certainly less of the processed foods. The study is fascinating because in the 1,000 people that were in it, the people who adhered most closely to the diet over that time had statistically significant rates and changes in their rate of cognitive decline. And that change was the equivalent of being about 7.5 years younger. So that's amazing, and it's especially amazing because we're talking about a population that's already over 80 years old. So to get back some of that cognitive functioning in that time, even at 80, was really significant. So let's talk about omega-3 fatty acids. This is also another great brain booster. Great sources of omega-3 fatty acids include nuts, fish, flax, and hemp seeds. You've probably seen it connected to salmon in particular, a fatty fish. These omega-3s actually really do double duty because not only do they provide the brain a great boost of support and protection, they also decrease cerebrovascular disease or have the potential to decrease cerebrovascular disease. So these are just great things for tools for you to use to keep your brain healthy and strong. I do like to mention that when you're choosing your fish, when you're choosing your supplements, you're choosing anything that you're choosing to put into your body, to consider the source. But this is particularly of importance with fish, as farmed fish has become more and more available to us. Sometimes it's the only thing available in the grocery store. But when there is a wild option, just consider that the wild option is not going to have the same types of modifications that the farmed version has. So for instance, the farmed version, they may or may not use things like antibiotics, color added, different types of additions to it that we may really not want or need, versus the wild version where we're not going to have those additional things to worry about that might be in it. So do your research and choose the option that's best for you. So we've talked about diet in terms of things that you can do to keep your brain healthy and strong. Now, of course, I'm going to talk about exercise. So again, this isn't groundbreaking in any sense that diet and exercise have a significant beneficial effect on your brain and on reducing your risk. But it is important to think about how and how much might actually benefit you. So the current recommendations are for aerobic activity, moderate activity 5 days a week, 30 minutes a day, certainly very beneficial. Really vigorous activity, not necessary to do 7 days a week, but a few days a week minimum for short periods of time, for short intervals of about 20 minutes or so. Some resistance training can be very beneficial. So this is something that can help keep your core strength, keep your muscle strength. A couple days a week, 8 to 10 exercises, 8 to 12 repetitions, very beneficial. And of course, as we grow older, flexibility and balance are key. And so this is really keeping that core strength that's going to keep you walking, that's going to keep you balanced, and certainly is going to prevent some falls. These are definitely part of the physical regimen workout. So most of the research shows that a brain benefit can occur with physical exercise with as little as 20 minutes per day. So that really is a minimum of 20 minutes per day. People who have risk factors, such as diabetes or heart disease or high blood pressure, may want to do more than the minimum of 20 minutes a day. But we do see that the brain has some changes that occur in what we call neuroplasticity in as little as 20 minutes a day. The neuroplasticity, big word, but just a fancy way of saying the brain becomes a little bit more flexible and works a little bit better. So those connections that we have in our brain through neurons work better. They connect more easily, and that means that information is transferred in the brain more easily as well. So neuroplasticity, definitely a good thing. And we need just a little bit of exercise on a very regular basis, at least 20 minutes a day, if not more, to get the benefit of having some neuroplasticity. I want to talk a little bit about stress, and I think that this is particularly important to talk about now. So your brain, your thinking, your memory, your decision-making, and your overall brain health is very much affected by stress. You've probably heard of cortisol. Right? So I think, ooh, cortisol. So when the brain has a lot of stress or trauma, or repeated sort of stressful traumas, it likes to pump out all kinds of cortisol. And over time, that can really have a significant negative effect on the brain. So managing stress really is a big priority. It's as big of a priority as diet and exercise. And so part of the question is like, well, how do you do this? And I encourage you to ask yourself, what am I doing to manage my stress now? So think about what kind of relaxation techniques do you use? When you are feeling stressed, how do you sort of cope and manage and process that stress? Meditation has become an increasingly popular and increasingly researched way to manage stress. And so we are seeing some benefits, long-term benefits that are even measurable years later from people who are practicing meditation on a daily basis. It's also really important to engage in pleasurable activities. So part of managing stress and part of health and brain health is doing things that are fun, doing things that are pleasurable. And so when we engage in activities that bring us pleasure and joy, we actually produce a physical reaction that gives our brains a boost. It gives our brains just a little extra protective cushion that helps keep our faculties a little bit longer. And so when we engage in those things, we reduce stress, but we also prompt chemicals and hormones that assist us in feeling good. So I think it's always important to not discount the importance of doing things that are pleasurable. So in the current time where we're dealing with the quarantine and the global health crisis and pandemic and fears about COVID-19 and other health issues, we still need to be mindful about, especially mindful about managing stress, but also mindful about doing things that bring pleasure. And they might be different than what they used to be. We joke a little bit that our sense of fun has changed a little bit now. Now fun is, I'm going to go for a walk tonight. But still, it's really important for us to continue to do things that are pleasurable and continue to manage stress. I'd say it's even more important right now since there are so many different stressors. If you're noticing things that are bringing you a lot of stress, also to manage those. Those might be media, it might be relationships, it might be different sources of stress, and whenever those can be managed, that will definitely help you think better and think clearer as well. The last thing on this list is external memory aids. So what I'm referring to here are things like an iPhone, a computer, and notes, a list, external memory aids, a calendar perhaps. And so when we use an external memory aid, it actually reduces stress. So I understand that learning how to use an iPhone can be stressful, but once you've done that and you know how to take notes or put things in your calendar, that actually becomes an external memory aid, a place to put information that you then no longer have to try and remember in your mind. And so when we use external memory aids, ironically, it actually improves our memory. I think a lot of times people feel that they need to try and remember everything themselves. And unfortunately, that it's not a proven technique, and it's going to lead to stress and to frustration. Because what really helps us is when we're not stressed and we've put our to-do list somewhere else, we can actually think much more clearly. So I encourage you to use an external memory aid, whether that's a calendar or a list or something on your phone, a place to put appointments, a place to write down the grocery list. It's not the challenge to stress yourself out by trying to remember everything yourself. And it may not be a sign of a memory deficiency if you can't remember everything yourself. Our memories are only built to remember about 7 things in our short-term memory. So when we're in the grocery store and we're trying to shop for 10 things, and you don't want to write it down because you're trying to give your brain an exercise by challenging yourself, you're really creating stress and very likely to not remember much more than 7 things. So using external memory aids is a great way to reduce stress and also to improve your cognitive functioning. I mentioned depression earlier as a risk factor for depression, or for dementia rather. So we ask, what does depression have to do with brain health? How is depression connected into memory loss? So we know that depression is a risk factor for dementia. People who are depressed earlier in life are more likely to develop dementia later. People who have memory loss are also more likely to have depression. And so the good news about this is that depression is a very treatable disorder. We have a variety of ways to treat it, but acknowledging it and taking steps to treat it can actually be a way to help promote brain health now and later in life. And currently, Alzheimer's Family Center has a number of services that can help manage stress and depression during this time. I'll talk a little bit about those in our resource section. So I think it's important to not underestimate how important depression is, and then also acknowledge that people who have memory loss, even moderate memory loss, can also have depression, and we still want to treat it. We still want to have people experience relief from depression, because ultimately depression will make the problem worse faster. And if we treat it, we might be able to keep some of those faculties longer. So it's just as important as treating diabetes or treating hypertension or hyperlipidemia. If depression is present, that would definitely be something you'd want to look at. So going back to what you can do to keep your brain healthy and strong, we've talked about diet, we've talked about exercise, we've talked about mental health and keeping an eye on that, and stress management. The other thing that's really, really critical to good brain health and giving your brain a buffer and giving it those fatty acids that help protect it and keep everything working is socialization. So socialization is actually shown to be one of the most profound ways to keep your mind strong. And there's lots of reasons for it. So when we socialize with other people, generally we're using our language skills, right? We're talking, we're listening, We're receiving information. We're interpreting that information. We might even be learning. If we're talking with someone, we might gain new knowledge or new information. And language is one of those things that when we stop using it, we are more likely to lose some of those skills. And so continuing to talk, continuing to chat with family and friends is one of the best ways to keep language skills fresh. Now, this is of particular concern at this time because people are at home, they're not going to as many social events, maybe they're not getting together, they're not going golfing, they're having lunch with friends. And so they might be home alone. They might be home with just one person or a caregiver or what have you. And so using those language skills and having the opportunity to talk and to interface with other people is almost always decreased. And so we really have to work harder to make sure that we're continuing to do that and continuing to use those skills so that we can maintain them and preserve them for as long as possible. In terms of language, so it's not enough just to go and be with other people and be a good listener. You also need to hold up your end of the conversation. So being a good listener is great, but being a contributor is absolutely necessary as well. And this is particularly true for someone who's having some memory issues already. So the amount of effort put into having conversations, engaging, interacting will definitely be protective factors and things that are within your control to keep your brain healthy and strong. It might be tempting to just talk on the phone and think that that's as good as being in person. Unfortunately, it's not. The very best thing is to have in-person conversations, and when you can safely do so with others, without putting your health at risk in any other way, to stay in touch beyond the telephone would always be ideal. However, in the meantime, if that's not possible, certainly video conferencing, Zoom, Skype, FaceTime, all of these applications that we can use to engage with people electronically is better than just an on-the-phone conversation. The last thing about your sort of social cognition is learning something new. So new learning, which is in our power to facilitate and initiate, is something that can have a profound effect on your brain health. When we take in new information and learn new skills, new words, new people, whatever it is, our brain has to create all kinds of wiring and pathways for us to store that information, for us to be able to retrieve it later. And so it's being a lifelong learner is one of the best things that you can do for your brain health. And so maybe this is a time to take up something that you've always wanted to do. Maybe a book you've always wanted to read, or a class you wanted to take that could be done electronically, or learn a new language. Very, very beneficial to the brain. And so the research has showed us that people who are proactive in new learning and proactive in doing things that are outside of their comfort zone, outside of their skill zone, will actually do much better years later, even if they have developed a memory disorder. So all of those things within your control to do to take up new things. People oftentimes ask about brain exercise. So things like when they're on the computer, they're playing games on the computer, or they're in one of those programs that say that they're exercising your brain, and they're wondering, is this helping? And the answer to that is maybe. It might be helping. It might not be helping. So what we know about it is, first and foremost, that we need more research related to it. But there is some evidence that doing brain exercises and brain games can have a function in protecting brain health and reducing risk and even slowing cognitive decline if it has occurred. So it's not all lost, but what I always tell patients is that brain games and brain exercises are wonderful as long as they don't take the place of exercise and socialization. So those are going to be our bigger priorities, our exercise and socialization. And when we have room for brain games, that's good too, but not the majority of your day, not 8 hours a day. We don't want anyone sitting in front of the TV all day or being on the computer all day or taking naps during the day, those things will be detrimental to your health. But when you are socializing, exercising, making good food choices, and adding brain exercises into that, that could definitely be of benefit. So about brain exercises, the thing about these is that for it to be beneficial, it has to engage your attention and it has to break routine in unexpected and non-trivial ways. So what that means is that it can't be something you're already good at. If you are doing crossword puzzles and you can finish that crossword puzzle every single day easily, you're not really challenging yourself. You're not breaking your routine or doing things that are non-trivial. Or the easy Sudoku or whatever it is that you like to do, you might be enjoying it and that has a benefit, but it's not really a brain exercise unless it's something that actually challenges you. So I have a couple of examples here of different types of brain exercises. And we'll start with this one. So this is an exercise that asks you to engage in some sequencing. So it says the empty triangle, which figures should be placed in the empty triangle. And so there is a number that goes inside of the last black triangle, and it fits in with the solution. So this is an equation, a sequencing task, and there is one right answer to it. And since this is a video, you have some time to pause it and try and figure out the answer. Going on, this is another type of brain exercise, and this is one that exercises the occipital lobe, which is the very back part of our brain, has to do with vision. And so when you look at this picture, do you see a series of black shapes on a white background, or do you see a white word on a black background? Oftentimes people easily see one or the other. And if that's true for you, I then want you to try and see the other way. So if you see the word, I'd like you to focus on just seeing the shapes. And if you see the shapes, I'd like you to focus on seeing the word. So this is a type of brain exercise because you're asking your brain to look at something differently than what it's accustomed to already doing. And it asks our brain to sort of be flexible and think about things differently and look at them differently. And that helps strengthen and give us more neuroplasticity. One of the games that I really like for brain health are called plexers. So plexers are a group of letters that represent a familiar phrase. And what you have to do is figure out what the phrase is saying by looking at the arrangement of letters and words and interpreting them in a literal way. So this is a very literal exercise. Now, some people are really, really good at this, but most people are not. And so don't get too frustrated. Allow yourself to think about it and try and look at it in a different way. And I bet as we go through a few, it'll become a little bit easier. So let's do some together. So this is an example of a plexer. This is a puzzle. It says messages, but they're sort of in different fonts and different sizes. And if I go back to what we're supposed to do is we're trying to look at the group of letters that represents a familiar phrase. So in this case, the word messages represents the phrase mixed messages. Okay. So the plexer puzzle is messages, and the answer is, this says mixed messages. Let's do another. So this is the puzzle, and the answer is down to earth. So we have the word earth going down, there's two of them, and the literal interpretation is down to earth, and that is our familiar phrase. We're going to do a couple more together. The answer here is not small business. That's a very common guess and a good guess. This is unfinished business. The word business, literally unfinished. Starting to make sense, right? I bet you guys can get the next couple. Give you just a little bit of time. Safety in numbers. How about this one?
Easy.
Got a coffee break? By now, I think everyone's getting them quickly. This is sleeping on the job. And the check is in the mail. Growing pains. And lastly, they have a round of applause. So flexors are a great example of a type of brain exercise that makes you think, makes you interpret. They're not that easy. There are ones that are even more difficult than that. They're novel. So they give us a new kind of challenge and a way to exercise our brain in a way that it's not used to doing. So the message is that it might be a good time to kind of reach out and look at a different way to challenge yourself and ask your brain to work in a different way. I want to spend just a couple minutes talking about resource and education. So the Alzheimer's Family Center, of course, is a wonderful resource in Huntington Beach with an adult day health care and outpatient mental health clinic and a number of other services that we provide. And so for you, a person who's wanting to take good care of their health, take precautions to keep their memory intact, keep their brain healthy and strong, I definitely recommend going through the memory checkup program. You can get a memory checkup. We like to call it like a checkup from the neck up, just like you get your physical. So you go get a physical every year. You look at your blood work. After the age of 55, you also get a memory checkup. You have to take steps to do this and ask for it. But this helps establish a baseline, and sometimes it's going to establish decreasing some stress because you may be worrying about things that can be alleviated by going and getting the assessment. So I definitely encourage people to do that. We also provide at Alzheimer's Family Center caregiver counseling. So this is a number of counseling sessions that are done by our expert therapists, specific to issues that caregivers are having. There are some programs available that this can be done at no cost. And so for a caregiver, especially right now, who's dealing with all of the challenges of being a caregiver during a global pandemic, this is a service that's available, and you can call and get more information about that. The center also provides legal workshops throughout the year. And so there's information about how to put those things in place for yourself, put trust and power of attorney if needed to make sure those T's are crossed and I's are dotted. We offer the Mind Booster series. Mind Booster is a 4-week seminar all about healthy brain aging. So some of the things we've talked about today and so much more information. And so that's a wonderful step towards taking to take care of your own health, brain, get information. Certainly information is power, resources to help yourself and tackle some of those worries. And then, of course, the Healthy Brain Fairs, which are wonderful events that offer all kinds of information and help people access information. If you're caring for someone with a memory disorder, the Alzheimer's Family Center does have a concierge service. So this is a virtual service where they can receive information about nursing and social services. They can participate in activities over Zoom and receive referrals. Also, I'd like to just stress that if you are caring for a loved one and or concerned about a diagnosis of memory loss, that seeing a neurologist is an important step. So beyond just seeing a primary care physician, but taking steps to advocate for yourself, to see a neurologist who's an expert in disorders of the brain and spine, getting an accurate diagnosis, and also exploring what medications might be available. Some of the medications that are currently used do have, in some patients, significant impacts in maintaining their cognition for a period of years, potentially. So looking at neurologists in the same way that if you were looking at a problem with cancer, you would see an oncologist. If you have a memory disorder, you see a neurologist, and being a good advocate to take care of your brain in that way as well. Adult day healthcare. While in the current pandemic, we can't do this in person, we can do the concierge services. But when it is available, utilizing this as a resource is a fabulous way for people to get socialization, to have structure, to have meaningfulness, to create relationships and friendships. All right. So, takeaways from this, what can you do? First of all, taking some time for yourself. Self-care. Self-care is so essential. If you're a caregiver, it's essential if you're worried about a memory loss or memory disorder. When we reduce stress, we're going to think better, we're going to perform better, we're going to be able to manage things better and cope better. Next is to ask for help. So these resources exist and they're there, and caregivers don't have to be alone. They feel like they're alone, but counseling can give you some tools to communicate with loved ones. The concierge services can put a nurse in touch with you to help you navigate the journeys. And so, again, these may not be things that you need for yourself, but they might be things that you share with someone who does need them. But for everyone over 55, scheduling a memory checkup. Again, your checkup from the neck up, just like you would see for your physical, just like you're watching your blood pressure, you're also going to get a baseline for your cognitive functioning and make sure that everything is checking out. The earlier that things can be identified or diagnosed, the better and more treatment opportunities are available. Education also, and so good job on taking the steps to attend the Healthy Brain Fair and receive this information, receive the education. It's a great way to be an advocate for your own health and your own wellness. And if you want even more information, take the Mind Booster series. This is a 4-week series. It's fascinating. There's so much information. I would absolutely recommend it to everyone to get the information about how we can age well, how we can be healthy and age. And then help reduce the stigma. So early intervention is important, and talking about it is important. When we have concerns, talking about it with your doctor, talking about it with your family, when you're concerned about others, talking about it with them and taking steps helps reduce the stigma, but it also helps receive treatment earlier. And that's critical for overall health and wellness. And lastly, share. Share with others, share what you've learned, share what you've experienced. The more we talk about Alzheimer's disease and how it looks, and what we can do about it, the better it can be for everyone who's affected, which ultimately is going to be most of us in some way, shape, or form. And so the more we share our resources and talk about things we can do, the better journey that this can be for everyone. That being said, on behalf of Alzheimer's Family Center, I am Dr. Cheryl Alvarez. This has been Healthy Brain Aging. Thank you for joining me, and hopefully I'll see you again soon.